All right, we're down to the last three chapters. Here's chapter 19, Injury, Poisoning, and Certain Other Consequences of External Causes, S00 to T88. So this chapter includes all of our injury codes, our poisoning codes, adverse effects, toxic effects, complications, all of those kinds of things. There are a lot of seventh character extensions in this chapter. I can't for sure say every code requires one, but probably just about every code requires one. A, D, and S are really commonly found throughout. They're not exclusive. They're not the only ones that are found. But A is for an initial encounter, so patient is receiving active treatment. D is for a subsequent encounter, meaning that the patient received active treatment and then is just coming in for some routine care during the healing or recovering phase. And those of you familiar with 9 are familiar with the aftercare, what used to be V codes. We no longer are going to be using those for injuries because we now have the 7th character extension to use instead. And then S is for sequela, and so we've talked about those in terms of being late effects. So these are those residual conditions that continue after the acute phase of an injury. So again, in terms of sequencing, whatever your sequela is sequenced first, and then you would use your injury code and you would use an S as your 7th character extension to indicate basically this is the replacement for your late effect code. Oh, and quickly I wanted to show you, let me just flip down. In terms of 7th character extensions, I wanted to show you my, whoops, wrong document, my favorite example here. So this is S52 fracture of the forearm. This is one of the, has one of the most 7th character extensions that I can find, is this code. So these are all 7th character extensions, so notice we get that A, initial encounter, we get the D that we talked about, subsequent encounter, and we have S for sequela, but you can see there's a whole lot more in here. So this one, we have A, initial encounter, notice indicates closed fracture, versus B is for an open fracture. And then these type 1, 2, 3A, 3B, 3C, these are Gastillo classifications for open fractures. And as far as I can see, they're only specified on fracture of forearm, but they might appear in some other places as well. So you can see it gets pretty specific in terms of your 7th character extension. It not only does it indicate initial versus subsequent versus sequela, but also the type of fracture, open, closed, and then now this additional Gastillo classification. It also indicates if there's routine healing, delayed healing, if it's a non-union or malunion. So be really careful that you go back and always check for your 7th character extensions. Don't just assume that it's the A, D, or S, or don't just forget them altogether, because that can be pretty easy to do as well. Few guidelines with injuries. Typically you're going to be coding each injury separately. If there is a combination code available, you want to use that. There are a few injury codes that just state like multiple injuries of and then a certain body part or location. Those typically you want to avoid those. If you can, you want to get as specific as you can. So try to use separate codes if you can, unless really your documentation just says multiple injuries. And then if you have multiple codes, then you want to sequence your most serious injury first. Remember that superficial injuries, so like a contusion, abrasion, something like that, we're not going to code those in addition to a more severe injury of the same site. So obviously, like an open fracture, obviously you're probably going to have some bruising there, some abrasions, things like that. It's all within that open fracture code. You don't need to code those separately. Again, if it's of the same site. If there is a primary injury with damage to the nerves and blood vessels, that primary injury is going to be sequenced first, and then you can add additional code for injuries to the nerves and blood vessels. For coding traumatic fractures, so we did do a little bit of coding with pathologic fractures back in the musculoskeletal chapter. So now we're looking at traumatic fractures. So these do indicate, as we saw with the fracture of the forearm, again, open close is going to be indicated in your 7th character extension. If the document doesn't say, we have the same guideline we had with ICD-9, if it doesn't say open or closed, we're going to assume that it's closed. So we assume it's closed unless it states opened. We now also have a specification of displaced or non-displaced fractures. That's just more specific codes, I guess, in ICD-10. And so we need a new guideline with these. So if it's not stated in the record, then these actually default to a displaced fracture. So those are kind of your, if you're lacking documentation, it would be a closed displaced fracture. I've mentioned the 7th character extensions, so they vary for fracture types. We kind of looked at, again, the A was that initial encounter for a closed, B was initial encounter for an open, the subsequent care, and then, like I said, as we saw with that fracture of the forearm, you can have several more 7th characters depending on how they're classified. Coding of burns and corrosions, we have the same guidelines that we did with ICD-9, so that's good. Just a reminder here that a burn is a thermal burn from some sort of heat source or electricity. Corrosion would be due to chemicals. And they're going to be classified by depth, so we have 1st degree, 2nd degree, 3rd degree, in extent, and then by agent. So, again, same specifications we had in ICD-9. We want to sequence the highest degree first. Any sort of non-healing burns are going to be coded as acute burns, which includes necrosis of a burned skin. And if we have a documented infection, we want to code that infection as well. We're going to assign a separate burn code for each site, and then we can also add an additional code for the extended body surface involved. So T31, burns classified according to body surface involved, and T32 would be corrosions. And again, this follows that rule of 9. So if we know the percent, then we can add that on as an additional code. And then, of course, we haven't talked quite yet about external cause codes. Those are chapter 20, but we want to add your external cause for burns and really all of these other injuries that we've talked about in terms of what occurred to make this injury happen. We still have our adverse effects and poisonings. We also have underdosing and toxic effects. So just a quick review here. Adverse effects are those things that occur when basically everything's done right. They're really, I kind of think of them like side effects. So the patient is given the correct medication, the correct dosage, they take it correctly, they don't take it with anything else that they're not supposed to. But something still goes wrong. That's an adverse effect. Poisoning means something went wrong. They were given the wrong medication, they took somebody else's medication, they took medication with alcohol, they took too much of it, they were poisoned, they intentionally took too much. Those all fall under the poisoning section. And here in a minute I'll show you the table of drugs and chemicals. Let's quickly talk about just some of the guidelines and then we'll take a look at that table. So a big change in 10 is we actually have a single combination code that includes the substance and the external cause. So those of you familiar with 9, we used to have to get a poisoning code, then we get our manifestation code, then we get an E code, or with an adverse effect we'd get our manifestation and we get an E code. Now it's combined together, the E code with the intent. So it's poisoning along with the cause or adverse effect along with the cause. So that's kind of nice. We have those combined together. So you don't need any sort of separate external cause code for these. You do need to use as many codes as is necessary to indicate, so if the patient took multiple medications that caused problems, then you want to use a code for each of those medications. If the documentation indicates drug toxicity, if it occurred with medication that was prescribed and taken appropriately, then that's an adverse effect. If it was improper use of some way, so it was not prescribed correctly or they took it with something else or they didn't take it right, then that would be a poisoning. And then we do have an underdosing column as well. This actually shouldn't be a principal or first listed diagnosis. That's going to be an additional code. So your first listed is typically going to be some sort of non-compliance or a complication of care. And then we also have our toxic effects for those things that typically aren't going to be ingested or non-prescribed medications. So let me show you, and I did want to point out on the Blackboard site, in our CM documents, we do have to use this drug table. So we haven't really used this yet. So if you're practicing your coding out of this section, you'll have to pull up this drug table. And I have that here. So here we can see that the left column has the substance, and then we have 4 columns for poisoning. So we have poisoning, and then we're trying to get to the intent. So was it an accident, intentional self-harm, an assault, or is it undetermined? Then we have our column for adverse effect. Again, you can think of this kind of like a side effect. And then we have our underdosing column. So basically you're going to come to the table, type in your drug, with the find button, it usually works pretty good. You'll get that over on the left side just like a main term, and then just come over to whichever column you need. So one thing you need to do when you first read that diagnostic statement is in your mind think, okay, is it an adverse effect, an underdosing, toxic effect, a poisoning, those are kinds of things. Abuse, neglect, and other maltreatment, we've always had some guidelines on these. Just to indicate that you're going to get a T code first, and then you'd have any sort of accompanying injury or anything that's going on there. And you also have you get a code for the assault and the perpetrator. And then here they do have Z04.71 and 72 for suspected abuse that has been ruled out. So we only want to code it if it's confirmed. So if it's been ruled out, that just gives some additional information as to why they may be running some additional tests to make sure that it was not abuse. Complications of care, just a few notes here. You want to use an additional code from category G89 if they're having pain due to medical devices. Remember, G89 was the acute versus chronic pain, so just to give it some more specificity. Transplant complications, you get a T code for the transplant, and then you can have additional codes to indicate the complications. Some of the complication care codes do have the external cause included in those, so they're a combination. You don't have to code those separately. And then just a quick note about the ventilator-associated pneumonia. We're not going to assume just because a patient has pneumonia and they're on a ventilator that it's ventilator-associated. It has to be documented as such. And then if we do know the causative organism, we want to code that as well. So here's our practice question. Patient accidentally took too much clonidine and has dizziness, initial encounter. So the first thing I'm going to do is figure out, okay, is this adverse effect or poisoning? So the patient accidentally took too much. So they did not take it as directed, something went wrong, and it was an accident. So we're going to be looking at an accidental poisoning here. So the next thing, I'm going to take my drug and look at my table of drugs and chemicals, which you can probably saw by my demonstration earlier. I'd already typed that in. So my substance over here is that clonidine or clonidine. And then here I'm looking under my accidental poisoning column. We have the T46.5X1. And then these all have 7th character extensions, so never just stop there. Make sure you take this and take a look at it in your tabular. So here we are, T46.5X1, poisoning by other antihypertensive drugs, accidental or unintentional. And then a lot of times you'll have to scroll back up to your category to get to those 7th character extensions. So in this case, we have it's an initial encounter, so we're going to add an A onto that. So I'm going to go ahead and pull that up. So the T46.5X1A. And then we also need to code the manifestation, which is the dizziness. If we come over to our index here, dizziness doesn't appear too much. Here's dizziness R42. We can take a quick look at that here. Couple occurrences, so dizziness and giddiness R42. So we captured both there.